Good afternoon. Thank you for joining DrFirst today to learn more about meaningful use and what this can mean for your practice. As you all know, our nation's healthcare system is truly undergoing a massive transformation to improve the quality, safety, and efficiency of care. To catalyze this transformation, Centers for Medicare and Medicaid, or the CMS, is overseeing the HITECH Act incentive program. The HITECH Act is part of the ARRA, or the American Recovery and Reinvestment Act. This program provides incentive money to eligible Medicare and Medicaid providers who demonstrate meaningful use of a health IT system. The goal of this is that by exhibiting meaningful use of a health IT system, providers will improve the quality, safety, and efficiency of patient care. In return, providers who demonstrate this meaningful use of health IT will not only provide a higher level of patient care, but will also reap the benefits of the financial incentives. Providers will also see a reduction in errors, higher availability of records and data, new reminders and alerts, unprecedented clinical support, and electronic prescribing capabilities. These technological efficiencies will streamline practice workflow and save practices time and money. To encourage the adoption of health IT, the federal government has created a financial incentive program. Beginning next year, eligible physicians who see Medicare and/or Medicaid patients will be compensated from $44,000 to $63,750 over a 5-year term for meeting the defined meaningful use criteria. If these same physicians do not use healthcare IT that meets federal requirements by 2015, they will face increasing reimbursement penalties of up to 5%. So how can eligible providers take advantage of the incentive program and avoid reductions in their reimbursements? It truly is as easy as 1, 2, 3. In fact, 2011 is the easiest year to achieve meaningful use. Achieving meaningful use in 2011 offers the greatest benefits with the least requirements to fulfill. The media would lead you to believe that achieving meaningful use demands a major investment in time, resources, and a potential overhaul of your practice. But the reality is that you have options. Providers can implement individual certified modules that, when used together, meet this meaningful use criteria. But before we explore your various options, let's talk a little more about meaningful use. The beginning of the meaningful use incentives is approaching fast, and it's important to understand all the details about eligibility, attestation, and meaningful use requirements. First, the meaningful use incentives are based on individual providers. So if you're part of a group practice, each eligible professional can individually qualify for the incentive payments if they demonstrate meaningful use. Second, you must decide which program you want to participate in, Medicare or Medicaid. Note that you can participate in either program that you are eligible for, but not both. Let's go over the Medicare program first. Eligible providers who meet the meaningful use criteria under the Medicare program will receive a maximum incentive payment of up to $44,000. This incentive payment is equal to 75% of their Medicare allowable charges for covered professional services, the maximum payment being $44,000. The first round of payments is scheduled to be sent out in May of 2011. To be eligible for this first round of payments, providers must demonstrate meaningful use for a minimum of 90 consecutive days to receive the full year's credit. To ensure you'll receive the first round of incentive payments, it is important to get started by January 1st, 2011. Waiting longer potentially jeopardizes your ability to satisfy other criteria. Based on this timeline, to qualify for the first round of payments, providers will have to attest to compliance during the month of April. To attest in April, providers will need to be meaningful users for 90 consecutive days prior, or they must begin in January. Getting an early jump on becoming a meaningful user is important. With the Medicare program, the first 2 years have the fewest requirements and the greatest potential for financial gain. By starting on January 1st, 2011, you put your practice in the best position to reap $30,000 in 2 years. Your practice can then put the incentive money towards converting your office to a paperless environment in the future. Now on to the Medicaid program. To be considered an eligible professional under this program, you must fit into one of the following categories: physician, physician assistant, nurse practitioner, certified nurse midwife, or a dentist, and have up to 30% of your patient volume be Medicaid patients. Or, if you're a pediatrician, 20% of your patient volume must be Medicaid patients. Unlike the Medicare program, Medicaid requires no additional enrollment to participate. If you see Medicaid patients and process claims with Medicaid, you have the tools you need to participate. After the first year, demonstrating meaningful use is required for each subsequent year to qualify for payment. As you can see at the bottom of the grid, the maximum Medicaid payment total is $63,750. The first payments for Medicaid providers may begin as early as January of 2011. The Medicaid payments are based on individual state participation, so be sure to check the status of your particular state. So now that we have an understanding of the two different programs, there are essentially 4 steps to making sure that you are ready to qualify. Step 1 is to decide for which programs you are eligible and which one you plan to participate in. Step 2 is to purchase a certified technology system like Rcopia-MU from DrFirst or one of our certified partners. A certified product allows you to meet 15 of the core and 5 of the 10 menu requirements to allow you to attest meaningful use of your system. Step 3 is ensuring that you meet the registration requirements. To participate, you must have a National Provider Identifier, or NPI. You must be enrolled in the CMS Provider Enrollment, Chain, and Ownership System. And you must have an active user account in the National Plan and Provider Enumeration System. Step 4 is meeting all the attestation requirements by reporting your patient data to the CMS. How can you be sure you are using a technology that will help you be successful? Earlier I mentioned the need for certified technology. The government has established ONC-Authorized testing and certification bodies. These organizations are authorized to perform complete electronic health record and/or electronic health record module testing and certification. They are required to test and certify that EHRs meet the applicable certification criteria adopted by the Secretary of Health and Human Services. To date, there are 5 bodies: CCHIT, Drummond Group, ICSA Labs, InfoGuard Labs, and SLI Global Solutions. Rcopia-MU meets the government's rigorous standards and is ONC-ATCB certified. Let's talk a bit about the technology that's involved with meaningful use. You often hear the terms electronic medical record and electronic health record used interchangeably, but there's a big difference. Simply put, an EMR is a patient's health record that resides within one organization. An EHR is a health record that spans 2 or more organizations and contains information from multiple sources. The definition of an EHR for meaningful use requirements allows providers to select from several options in order to meet meaningful use requirements. The first of these options is to adopt a modular approach, meaning to use individual systems to qualify for federal incentive money. An example of this is Rcopia-MU from DrFirst. Rcopia-MU combines the Rcopia e-prescribing system from DrFirst with a patient registry. Rcopia-MU is a complete EHR and meets all meaningful use criteria. Your second option is to go 100% paperless. Going paperless requires the purchase and implementation of a certified EMR. This track is not required at this time, but for practices who are ready to go completely paperless, implementing a certified EMR may be the best long-term option. Implementing Rcopia-MU is an easier and more cost-effective way to take a more incremental approach to a practice's migration into this new era of healthcare technology. For practices that are not ready to go 100% paperless, this stepping stone approach is a great way to test the waters and still qualify for the incentive payments. Your third option is implementing e-prescribing or waiting. For practices still unsure of electronic workflow, e-prescribing is a great way to start. Starting with just e-prescribing will mean you miss out on the majority of the incentive payments. Waiting is never a good idea as the incentive funds decrease the longer you wait. So why should a practice choose an EHR? Aside from the obvious incentives available through the program, there are many patient care advantages to having an electronic health record. An EHR improves patient safety by compiling all of a patient's health records together in one location, allowing you to more easily identify potential safety issues. An EHR also allows you to decrease the time spent on organizing and tracking a patient's health record. Additionally, an EHR increases patient education by allowing providers to link information with the patient's computer, providing them with important healthcare resources and information. Let's go over a few scenarios, one of which is bound to best describe your practice situation. Like a racing car pit crew, some practices are able to stop everything quickly and quickly change all 4 tires. If this sounds like your practice, DrFirst has several options for you. They include talking to one of our over 130 EMR partners. In part 2 of this webinar series next month, we will have our ONC-ATB certified partners give a short presentation about what you should look for when choosing a completely paperless system. These partners are part of our Open Borders program. We add an average of 1 new partner a week, so if you are ready to go 100% paperless, you truly have endless options and a guaranteed migration of your patient data to your future EMR. For some practices, it's wiser to change 1 tire at a time. Choosing this stepping stone approach allows you to meet the federal requirement in an efficient and cost-effective way without going 100% paperless right away. The bottom line is that you have options for satisfying meaningful use criteria. We are uniquely qualified to help you choose the right complete EHR tailored to your practice's needs. So, if you're ready to start collecting incentive money but not ready to go paperless, let's check out DrFirst's golden solution for achieving the federal requirements. Rcopia-MU, the modular approach to meeting meaningful use. Our certified modular approach to achieving meaningful use allows a practice to slowly and incrementally adopt the technology needed to qualify for the incentive money without making one costly purchase decision. By implementing a system that uses certified modules to fulfill meaningful use requirements, your practice will benefit from a quick implementation, meet the meaningful use requirements for the next 2 years, and enjoy a high return on investment or ROI. Plus, this option provides an appealing baby steps approach that will ease your staff into the new technology. But remember, possessing an electronic health record system is just the first on the road to meeting meaningful use. Providers must actually implement and correctly use an electronic health record system that fulfills the meaningful use requirement.